Thank you, Warren, and good afternoon, everyone. We are delighted to be here this afternoon in conversation with you, and importantly, in conversation with Ken Frazier. Ken is one of my dearest and longest standing friends, and as we thought about the conversation that we might bring together today, I can't think of a better opportunity for us to contemplate the conundrum we find ourselves in at the moment. This industry, which has been, the biopharmaceutical industry, has been largely responsible for the reduction in mortality rates, the improvement in survival for cancer, for certain infectious diseases, for cardiovascular disease. It's made HIV/AIDS a chronic disease, yet this industry is under fire like no other industry in this country. So how is it that we can contemplate an industry that has offered so much, given so much, and returned so much benefit not only to patients who benefit from these therapies, but to shareholders who make their investment and innovation possible? How is it that this industry can come under such fire and rank just above the tobacco industry in terms of support? So that's our conversation this afternoon. And for those of you who know Ken, you know that he is brilliant, an intellect.
Keep it coming, Tony.
See, I have never told him that because...
and my wife says the opposite. She says I suffer from chronic high self-esteem, so this doesn't help.
He's a clear voice at a time when, as clouds gather on the horizon, we need both clarity and we need leadership. And we'll talk a little bit about the importance of moral leadership in business when there are vacuums in leadership elsewhere. So, Ken, let's jump right into the conversation. We've got something of a prisoner's dilemma. Mm-hmm. The biopharmaceutical industry has brought so much good in the ways that I've described in those opening comments, yet society actually hasn't wanted to collaborate and celebrate those achievements. So why is it that we stand at this crossroads today?
So first of all, thanks for having me, and I hope that we have a good, open conversation here. I'm going to try to say some things that are not just anodyne comments here, because these are important issues for our society. So to answer your question, I think of business as having two roles. One is to serve society and one is to serve shareholders. And I find being the steward of a company like Merck to be a particular challenge because the decisions that we make every day, the trade-offs that we deal with, involve life and death, to be honest. And so while you're absolutely right that we are changing, for example, in the area of cancer, the paradigm under which certain types of malignant disease are treated. We're now having people live much longer. If you now are newly diagnosed with non-small cell lung cancer and you use a regimen including our drug Keytruda, your chance of dying is reduced by about 50%. That's an amazing number. And yet these drugs are highly expensive. And a number of people in our society find that they either flat out can't afford them, or if they can afford them, they can only do so with a high level of financial anxiety. So there's sort of a challenge here on both sides of that equation. From a shared value perspective, we're creating a huge amount of therapeutic value in the world, without question. At the same time, from an economic standpoint, individuals and healthcare systems are struggling. And then in the United States, there is the issue around why should Americans pay so much for drugs when other people in other countries around the world are paying a lot less for drugs, or at least they're perceived to be paying a lot less for drugs.
So let's dive into that. At the end of February, you sat on Capitol Hill, testified before the Senate.
Yes.
And laid out, answered several questions, but you laid out a 5-point plan. Help us understand, because it is a fact that people do pay less for these therapies outside the United States. Help us understand why that's the case.
Well, so when you look at the international pricing of medicines and healthcare, there are a number of things that need to be understood. So first of all, Americans, without question, pay more per capita for drugs than most other developed countries, Japan and Europe. At the same time, as a percentage of what Americans spend on healthcare, we actually pay less than other people. So how can that be true? Could it be true that per capita you're spending more on medicines, but as a percentage of overall healthcare spending, you're spending less on those same medicines? Well, there are a number of reasons. The most significant of which is in those jurisdictions around the world where price controls are used to keep the prices of new medicines down, there are two aspects that don't often get talked about. The first of which is that many of those places, I'll use the UK as an example, actually don't allow people much access to those medicines. So, you know, Americans, when we invent a drug like our drug for cancer, immunotherapy drug for cancer, those drugs are made available to Americans essentially immediately. I was visiting in France about 6 months ago, and I had dinner with President Macron, and I was showing him the delays between the introduction of new drugs in the United States and France, and he appeared to be surprised to see those long lags, but people died during that lag. If you look at survival of lung cancer patients in the United States versus UK, you don't want to live in the UK. If you want to get lung cancer, it's better to get lung cancer here. So the first thing is the availability of the drugs and the timeliness of that. The second issue is the flip side of those price controls, which keep new drug prices down, is that those same price controls represent a floor for generic drugs. And in this country, 90% plus of the drugs that are used by volume are generic drugs. And so the way our free market system works is new drugs tend to be expensive, and 90% of the drugs by volume, generic drugs, tend to be a lot less expensive than they are in Europe. So our country is actually a good place to be an innovator, and some of those other countries are good places to be for companies that actually don't have new drugs.
So, but let's, okay, so how do you square that though? Because there's a public conversation that's happening in every kitchen, around every kitchen table that says the prices of pharmaceuticals are just too high.
Mm-hmm. And by that they mean new pharmaceuticals. I want to make that distinction because 90% of the drugs in this country that are being used are generic drugs. In fact, Merck is the inventor of two of the top three.
What's the price of Keytruda?
Keytruda is about $164,000 a year for a treatment.
All right, so $164,000, and to deliver
and that's really expensive.
That's really expensive. But to deliver what benefits? So what do we say to the 85-year-old grandmother who develops non-small cell lung cancer, who is of ordinary means? Can she get Keytruda?
Well, it depends on where she is and what her economics are. I will start by saying last year, 2017 into 18, I don't have a full, I haven't looked at it recently, but we had treated about 20,000 people for free with this drug. And that doesn't answer the question if you're above the poverty level. Mm-hmm. So if you're above the poverty level, the challenge then becomes, what is your insurance coverage, right? So let's back up. We haven't gotten into that. You know, often the discussion about the affordability of drugs comes around to the list price of drugs. There's a complicated system that we have in the United States where often the list price of drugs is significantly higher than what the real net price of those drugs is. And the question becomes, what kind of coverage do you have? I'll just make this comment about drug pricing and why drugs tend to be the focus. In the United States, on average, if you use in-network hospitalization or physicians, this is a broad generalization, but I've seen this data presented, patients will pay 3% of the in-network price for hospitalization. That's the lower price that the health plan negotiates with the hospital. Pharmaceuticals, by contrast, on average, patients pay 13% of the higher price. So the out-of-pocket cost for pharmaceuticals is much higher. And there's a whole issue around why that is the case. But in reality, and I said this when I was testifying in front of the Senate, you've got this system where you have high list prices and low net prices. And just to, again, to give you data, last year across my entire US product line, the aggregate discount from list was 45%. Okay? And so what you have is a system where you're having very high list prices, rebates being paid into the system. Those rebates are not passed on to the actual consumer at the counter. And so you end up with a situation, frankly, and I'll just be blunt, often the sickest people who are paying this 13% of the list price are actually subsidizing healthy patients because that savings is used to reduce premiums overall. And that's sort of like a regressive tax if you think about it. So I want to be very clear to everybody within the sound of my voice. I said when I testified in front of the Senate, this industry has a duty to help ensure that people get medicines. And that means we have to be responsive and responsible in how we actually charge people for our medicines. But if you're going to solve this problem, as I was just trying to lay out, you've got to look at the entire healthcare system and say, how do we create the incentives to bring those costs down without killing the ability of these companies to innovate?
Okay, so what you just said it's a leadership stance,
yes,
right? Because not all of your colleagues who helm these great companies would say the exact same thing. So what is it that, to just move away from pricing for a moment, what is it that makes you an exceptional leader with the clarity of thought to take a position that's potentially controversial?
Well, let me start by saying I don't consider myself to be an exceptional leader in that way. I consider myself to be the steward of a company that's existed for 130 years and has done amazing things, has been a force for good, you know, in terms of everybody within the sound of my voice has been touched by a Merck product. You know, in this country, we have something like 13 or 14 pediatric vaccines that are regularly given to every child that's born in the country. Well, Merck is responsible for about 10 of those, right? And so when you talked about cardiovascular health, antihypertensives, and cholesterol drugs, the first drug that actually made HIV a chronic manageable disease was Crixivan, which was a Merck drug, right? So from my perspective, this is a company that's been around for 130 years. It's been committed to two things. One is to scientific excellence, and the second one is to providing service to humanity. So I had the pleasure as a new employee of the company in the early 90s to work for a truly great CEO, a man named Roy Vagelos, who was the CEO of Merck in the early 90s and was a great CEO. And he used to say to me, there are only two metrics that matter in a company like Merck. He said, you know, your finance people will have all kinds of metrics, your manufacturing, your marketing people. He would say to me, Ken, just remember there's two metrics. One, how many people do you help? And two, how much help do you give those people? And he said, as long as Merck is maximizing those two metrics, all the other metrics will fall into place. So what I try to do every day when I sit behind the desk is to remember what this company has always been about. And you know, the modern day founder of Merck was a guy named George W. Merck. And George W. Merck was on the cover of Time magazine in 1952. There was no social media in 1952. If Time magazine put you on the cover, it's what we used to call in my old neighborhood a BFD. Okay? And Merck was a relatively small company, but he gave a graduation speech at the University of Virginia in which he said, medicine is for the people, not for the profits. And the more we've remembered it, the more the profits have followed. And every single Merck person knows that quote. The significance of that is in 1952, when he was on the cover of Time magazine, that was roughly 20 years before Milton Friedman started to say that the only responsibility of corporations was to their shareholders. So I would actually argue, if you look back at history, go back to that time in the 1950s, there's only 12% of the Fortune 500 that existed at that time that are still in business. And I would argue that those 60 or so companies have been driven by a sense of purpose, not a sense of profit. What allows them to exist, what allows them to go through good times and bad times, to recruit the kind of talent that you need in order to succeed, is that the company has to be committed to that. So I don't say I'm committed to it. I'm just following the footsteps of my predecessors at Merck.
But I'm going to take exception with that. And I'm going to take exception to it because there are roughly 3.5 million people on Twitter who would disagree, and they could be right or wrong. But this is a statement from Kenneth C. Frazier, Chairman and CEO of Merck. This is a Twitter posting from the summer of 2017. I am resigning from the President's American Manufacturing Council. Our country's strength stems from its diversity and the contributions made by men and women of different faiths, races, sexual orientations, and political beliefs. America's leaders must honor our fundamental values by clearly rejecting expressions of hatred, bigotry, and group supremacy, which run counter to the American ideal that all people are created equal. As CEO of Merck, and as a matter of personal conscience, I feel a responsibility to take a stand against intolerance and extremism. That is not a company statement. That's a Ken Frazier statement.
Well, you know, it's interesting. When we put out that statement, thank you. Thank you. When the whole Charlottesville thing happened, it was clear to me as a matter of personal conscience what I wanted to do, but that statement is carefully worded. I called my board on a Sunday and said, I'm going to resign from the President's Council because of my personal conscience. I can either say in the statement, I do this based on my personal conscience, or I can say, as the CEO of Merck, and as a matter of personal conscience, I feel the responsibility to withdraw. But I leave it up to my board whether or not they want me to speak on behalf of the company. And I'm very proud to say that the board immediately and unanimously said, no, we want you to speak as the CEO of Merck, as well as a personal matter of personal conscience. Because I did have I did have a responsibility to the company. You know, it was relatively clear when I put that statement out that I was likely to get a response. I'd heard of the tweeting before. And I wanted to make sure that my board felt that I was being responsible as the institution's leader. And again, I'm very pleased that the board said, this statement that you've written represents the company's values, not just yours.
But did you calculate or did you contemplate, and I'm sure you did because I know you, the potential risk to Merck reputationally? How did you make the judgment that your personal conscience was so important that you would put Merck in the middle of that?
So that's actually a very good question, Tony. You know, I have to start by saying I don't believe that as the CEO of Merck or CEOs of any publicly traded companies that our role is to tell our employees, much less society, what they should think about political issues. So I try to stay out of politics. I felt that when the statement the president made was made public that Saturday afternoon, I remember I was furniture shopping with my wife for our apartment in New York City, and so as a result, I was paying even more close attention to my iPhone than I normally do. And when I read the president's comments, I felt that that wasn't a question about politics. I don't think people carrying torches, chanting what those people were chanting in Charlottesville was a Republican or a Democratic issue. I'm sorry, Think how many Americans of both parties, conservative, liberal, died on the battlefields of Europe because we didn't believe in what that swastika represented. And so for me, I felt that this was outside the context of politics. This was a question that went to what we as a society, what we as a group of people who aspire to be rational and tolerant and enlightened believe. Because America is a country that was based on a set of ideals. And we haven't always lived up to those ideals, but those have been our ideals. And so in this case, I felt very strongly that I had not only the right, but the responsibility to step up and say, we don't agree with what those people were chanting in Charlottesville. And fortunately, a lot of other CEOs sort of came around to the same point of view.
We're going to take some questions from the audience in just a moment, but you know, as I think, and I've known, this is the disclosure part of the conversation, I've known Ken since 1992. We started at Merck within a couple of months of one another. And our friendship goes back to those days when Roy Vagelos was a very important person in both of our lives, and certainly was responsible for teaching me, and I've heard you say yourself, a lot about what to do right in business. So at a minimum, this leadership stance, this point of view, may come out of that heritage. But one of the earliest stories you told me shortly after we became friends was a story of Willie Bo Cochran. And I want to explore that story. First of all, you should introduce Willie Bo to the folks in this room and talk a little bit about who he was. But I have a sense that the perspective you bring to your role and the role you play as a business leader started well before your days at Merck. So talk a little bit about Willie Bo Cochran.
So when I was a lawyer in the private practice of law, and I was fortunate to be in the private practice of law for 15 years before I joined Merck, among others, I represented a prisoner on death row in Alabama named Bo Cochran. And when I met Bo, he was 13 days before his execution date. He was convicted of a murder in a very difficult set of circumstances where I thought pretty clearly the state didn't have the evidence to convict him, but he was 13 days before his date, so you have to litigate the stay and so forth and so on. Long story short, the man spent 19 years on death row in Alabama for a crime he did not commit. And we were able, because we were able to get the federal court to intervene, to let us re-examine the evidence, to show that. I say it was clear because when we had his retrial, the jury acquitted him in less than 1 hour when all the evidence was produced. And I'll never forget the blackboard in the jury room, they wrote not enough evidence, right? So this was, for me, I will say, as a lawyer, the greatest adventure of my life and the greatest individual achievement I will ever have is representing Bo Cochran. But I think where those two things overlap, the whole George Merck quote and the whole Bo Cochran case, is there is this concept of what we call justice, okay? I mean, if you look at our Constitution, it says we are here to do a number of things, and to establish justice is before even establish the common defense. It's the first obligation of society. And there's an aspect of this in medicine. The idea that if you're born in a certain place, if you're in a certain zip code, your life expectancy should be different than people in another zip code is a justice issue, if you get my drift. You know, Roy Vagelos, when he was CEO of Merck, you know, he donated Mectizan. We've donated 3 billion treatments of Mectizan in sub-Saharan Africa to get rid of a very horrible disease called onchocerciasis, or river blindness. I'm very proud that this generation of Merck people developed an Ebola vaccine that is being used in the field. We've now donated 145,000 doses, and the World Health Organization is using them in the Congo now. That's a justice issue at a high level. You know, I often say to my colleagues, we were smart enough to pick our mothers, right? So we shouldn't suffer the way our fellow human beings suffer. So I see the parallel between that death penalty case and what Merck stands for in terms of relieving human suffering, unnecessary human suffering. And that may sound sophomorish or corny, but you know, I have a table full of scientific colleagues over there. And what's going to make Merck successful in the long run is the quality of the science. And what makes the quality of science at Merck going to be high is the quality of the scientists that we can recruit. And these people were all academic superstars. They didn't have to come into industry. They didn't have to come over to the, quote, dark side. If they come to industry, many of them want to work for a company that they believe shares their values. And so as we continue to recruit the kind of people that we're going to need in order to invent new drugs, and Tony, you know that when you set out to do these things, because you're doing it at Humanity, we fail 90+% of the time when we set up a new program. So 90% of the things that we originally thought were good ideas and worth the money and the focused exploration fail. So if you don't have these principles, if you don't have these values, if you're not just trying to create value for society, if you don't want to realize your own values, in the long run, you don't recruit the talent that you need in an organization like this. So I hope that wasn't too long. But
no, that was terrific. Why don't we take some questions from the audience? And I think we've got microphones that are coming around, so.
Hopefully rude questions.
Why don't we start with Laurie Glimsher?
Thank you. And thank you, Ken, for being here. That was really inspirational. To my mind, if we keep the patient at the center of everything we do, then it is very important for the private sector to work with academic medical centers, which of course are under some threat now,
Yes.
given limited government funding.
Mm-hmm.
Merck, I think, has been a leader in working with academic medical centers, and I wonder if you would say a few words about your perspective on the value that academia has brought, other than stealing some of our very good people, I must say, has brought to Merck.
So I think, you know, when we invent medicines that we hope will have value to patients, but we don't touch the patients. At the end of the day, it's the physicians who treat the patients. And, you know, the academic medical centers play an extremely important role in our society because not only do they treat people at a very high standard, but they're actually doing the fundamental research that actually moves us forward, that allows companies like Merck to engage in innovation. And so this partnership that we need to have between academic medical centers and companies like Merck are incredibly important. In fact, all of this is part of, in my view, an ecosystem. Academic medical centers, many of the small biotechs that are represented in this room, large pharmaceutical companies, patients, physicians, we all have to work together if we're actually going to improve not only the quality of healthcare therapeutically, but start to solve some of these really vexing economic questions, because we can't keep afford to paying more and more and more for healthcare. I said we pay more per capita than other countries do. The fact of the matter is we don't have better health outcomes than a lot of those countries that pay less. And unless we're able to work effectively together to ensure that we can bring the best innovation to people and help people to live lives so that they can, you know, actually live better and longer, I think we're just going to continue to go down a rat hole, spending more and more money and getting less. So, you know, I want to put a plug in for academic medical centers. I want to put a plug in for NIH. As a society, we shouldn't treat our academic medical centers as though they are just, in effect, fungible with other institutions, because they have to deliver care and then they have to do the research. And that costs money. It's a little bit like my point about pharmaceutical companies. People say to me, you make a ton of money on the drugs in the marketplace now. Well, I invest $10 billion a year in R&D. If I don't make money on the drugs I have in the market today, then no drugs are going to come in the future. And I think I feel the same way about academic medical centers, is people just think they're there to treat people, but they're there to treat people, they're there to educate the next generation of physicians, and they're there to do the research that allows companies like Merck to discover new drugs.
But Ken, if it's so clear and simple while we're waiting for the next question, what are we missing? Because this becomes an overheated exchange and debate around the kitchen table.
Yeah.
So you've made a compelling case for the leadership stance, for the need for future investment to take care of all the opportunities we have for scientific innovation. What are we missing as a society? What do we not see that's very clear for you?
So first of all, I actually do think government is failing to solve our biggest problems across the board. And I think you can see that with the way people look at government. I think business now has a really important role in solving all kinds of societal problems. When you say what's missing, I got asked by one of the senators, just give me the solution. And I said, no, that's a cop-out. I'm not going to play that game with you. Anybody who says, I know how to fix health care, and here it is in one sentence, it's an unserious conversation. It's like, what are we going to do about education? The fact of the matter is, as a country, we're not educating our young people. And, we have to import talent in a company like Merck. Something like 60% of our biostatisticians are Chinese nationals because we just can't get people with the mathematical skills. We should not be in that position. So I have to say that I think the answer to your question is that smart people have to sit down and say, we've developed a system over time that is not working for us anymore. It's costing too much. It's delivering too little value. How do we now set up a new system, and then how do we migrate from the bad system we have to the new system? That's complicated. But I'm willing, and I said there, and I mean it, I'm willing to have Merck sit at that table to try to solve some of these healthcare issues. I'll say one more thing about the role of business. Our country is incredibly divided now. It's no longer the case that if somebody doesn't agree with you on a political issue, you just disagree. That person today is your enemy. And we can't afford to have a country in which we are increasingly armed camps of people who don't understand one another. And if you start to think about it, our society is more separated than it's ever been. Our schools are more segregated. We tend to live in communities that are enclaves of people that are like us. Because of social media and cable, you can go and listen to people who already agree with your point of view. I think the workplace is the last place in the United States where people can't choose to interact with people who are like them and think like them. So I think business has an incredible role to play in helping us as a republic stay together. And I think business leaders have to step up to that because, again, as I think about it, the workplace is the last place where Americans interact. When we had World War II, you hear people who come back from the greatest generation saying, the war fixed us around what made us Americans. It made us focus on what was in common. Those of us who lived through 9/11, for about a month, we were Americans again, right? I think today business has a role to play in solving the education problems, the housing problems, the food problems, and the healthcare problems, as well as this issue of why Americans no longer can work together. I didn't mean to preach about that.
That's okay. Carol Falk.
Thank you, Tony, and thank you, Ken. Speaking about the workplace and your incredible commitment to diversity, can you share with us how you've been able to help embed and advance diversity within Merck? What has helped work within Merck?
Okay. So let me start by saying I think the company's values have helped to begin with. But you've got to do more than just express values. It takes more than rhetoric. I mean, if you look at these companies around the country, for example, just at the CEO level, I saw some data the other day saying that there are more CEOs named Michael than there are women CEOs, right? And they're
Sorry,
out of...
Mike.
I didn't mean to go there.
We got Mike Mahoney right here. So.
And in the Fortune 500, as you know, Tony, there are only 3 African-American CEOs. So the challenge becomes, how do you go past the rhetoric in our society of equality and get to a world in which people can succeed and develop their careers? I think everything in the end comes down to incentives and economics. And I think you've got to put managers in a position where if they take a chance and promote someone that's different, and I'm going to say something that we're uncomfortable with in this room, but there's no use in not saying it. Certain people start off as members of what I would call high status groups, and others start in what I call low status groups. And if you're a member of the high status group, if you know nothing about the individual, you only know that they're a high status person. By contrast, if the person is a low status group member, all you know is that they're a member of the low status group. Why do I say that? Because often, if you're going to promote somebody who's a woman or a minority person, that manager feels that he is taking a chance. And so the question becomes, if you don't reward those people, if they don't see their own careers being advanced because they're actually committed to creating an environment that's diverse and inclusive, then I think at the end of the day, you're just talking in the face of very powerful economic and social incentives that go the other way. I'm very fortunate in my life. I was a lawyer in a law firm, and I came to Merck, and I have to say, I look back at my career, and as the CEO of Merck, the fact that Roy Vagelos took me under his wing when I was a 38-year-old person is what made me successful. On my best day, I'm simply imitating that man. Had I not had access to him, right, that access gap would have prevented me from being where I am. And I have to say, for those of us who are now presumptive insiders, we have to think about bringing some of the presumptive outsiders in the tent.
So I want to come back to that. Another question from the audience. While we're thinking, oh, there's one here. Just here.
I wanted to go back to what you were talking about before with the problems in our country. And I'm just wondering, Ken, what you think about the growing call for Medicare for all.
Okay. So I have to say, the call for Medicare for all is one of those things where, again, in politics, we don't really want to sit down and have a serious conversation about what the economics of that really mean. I think if you look at our system, the private system that we have, there are different systems around the world, right? You know, there are systems that are socialized medicine, there are systems where there's single payer, there are systems where there's private payers plus government. We have a hybrid system in our country where most of us are insured through private means, but there's Medicaid and Medicare and all of those things. I think if anyone who's serious about what it would cost to implement what people are calling Medicare for all, you know we can't afford it, right? It's not affordable. And by the way, people who are covered under private insurance want to have enough control over their insurance that they'll resist it politically, right? So I think the idea of Medicare for all is one of those things that has, if you don't think about it more than a second, it might sound like it has enormous rhetorical appeal, but it's never going to happen in our country for a whole host of reasons. We won't be able to afford it, and there'll be opposition from people who sort of like their private health plans. You might remember when we went to Obamacare, the promise was, and if you like your coverage, you can keep it, right? Because people are going to want to have control over their own health care. But still, we have the problem in the private situation. The free market does a good job of allocating scarce resources, but it hasn't worked in health care because a lot of people don't have access to the drugs that I use. So the question to me isn't about Medicare for all. It's really about how do we ensure that that subset of our population that can't afford to have access to medicines, we make a social commitment to those people.
You've got Boston's best and brightest business leaders in this room who are responsible for training the next generation of leaders. Tell us something we don't know.
Well, that's a hard question. Well, so I do think that most leaders miss a couple of things. So first of all, when I talk to my kids and their friends, they really want to work for companies that have a sense of purpose. I think that's the first thing that I would say. I think the second thing that I would say is that the old hierarchical systems of governance in companies are no longer going to work. The world is changing much too fast. And so if we can't empower people, inspire them, give them the level of accountability and autonomy that we want for ourselves. Now, see, we get autonomy, but now that we're running the place, you know, we get autonomy. But those younger people, those junior people, those scientists in the lab or people in the manufacturing plant, they have brains and they want to be able to use their own autonomy to contribute. So I would also say that I think the old-fashioned structures around corporate governance are no longer going to work.
Okay. Please join me in thanking my